We have a crisis in British Columbia. We have patients that can't get a family doctor. In a developed country like Canada, there is no reason that you should not be able to have a family doctor. So what's happening? What are the doctors doing that they can't take on more patients? They are filling up their days with work that could be done by others. For example, I don't need to be the social worker, the physio, the counselor, the dietitian. I need to be the doctor. I need to do the diagnosis. I need to do the treatment plan. I need to do things that doctors do. But I need a team. I need a social worker. I need a physio. I need a dietitian. I need a counselor so that the patients can get the services they need without me trying to pitch in and try and do the best I can when I'm not trained to do those jobs. That would also free me up to see other patients, and that would improve access, and it would improve attachment for patients getting a family doctor.
For me, I'm very excited about the possibility for team-based care because I think that the needs in our communities are growing much faster than we can deal with them individually. And so it's important that we have everyone working together, that we're hearing all of the voices, and that we're all able to work to the scope of our practice. Doctors, nurses, other allied healthcare professionals, so that we can meet patients where they are. We can keep them at home longer, we can prevent health, we can find out what it is that they need. And so by working together, by having a new system, we'll be able to meet the challenges together.
Primary care teams, absolutely. So I originally wanted to go into medicine. I was encouraged to go into medicine because I was talking about a dream when I was in my previous undergrad program about developing interdisciplinary teams that would go to remote, rural First Nations communities and provide care on a regular basis, understanding that some of these communities are very tiny and couldn't sustain full-time professionals, but they could, a group of communities could. And so we could go to, say, Stella on Monday and Notley on Tuesday. And with Caries County Family Services, I do go out into communities and on a regular basis, and I follow up with virtual medicine. And I work with some healthcare providers like drug and alcohol workers and mental health clinicians and MOAs. But even still, we work very much in isolation because there's so few resources that most of the time we need to be spread out to try to cover as many communities as possible, which does still create some fragmentation because we're not really working together. And so for me, I would love to have a more synthesized approach. I would love to have somebody who is more culturally embedded, either a healer or an elder that I work closely with, or having somebody who's trained as a very top level MOA or LPN or something like that, so that they could help me get patients going so I can see more. So starting some chart notes, doing some vitals, but also helping with follow-up and coordinating care after I see them to make sure they can go get the labs, or that they know how the process of booking their appointment for a referral to a specialist, or those sorts of things to help people navigate the system, because the system is very complex and a lot of people from rural, remote places would find it hard to know how to navigate a trip to Vancouver to go to VGH or St. Paul's, and so having those kind of community outreach workers or patient navigators, I think would be so helpful. And I think with the physicians and carers at Kenny, there's now 10 of us, and we've worked really hard at building our relationships. And so I think we're at the point where we can help to invite more healthcare providers, so we can get to the point where we're not just putting out fires, but actually building up the health and resilience of Indigenous people by better and more adequate healthcare teams.
We talk about teams, but we need to make sure that that team includes the family, the patient, the non-paid caregivers. I have a mother who's soon going to be 97 who needs to go into care. I have been providing assisted living for her along with my sister, but she's no longer safe at home. I've had firsthand experience with the system, and I know that there needs to be more of a voice from the family and the patient.
The thing that I'd like to bring as a story would be my wife's journey in the healthcare system, and fundamentally how there was a determination early on of something possibly being wrong with her heart, but wasn't certain what it was and if in fact it was anything that we should be alarmed by. Over time, we had to take actions on our own to lessen her workload, and so she stopped working. We moved over to Gabriel, and over time we watched things progress. In the meantime, all through this time, roughly 20 years, she's gone through a number of specialists, and the results kept coming back ambiguous or certain to the degree that it wasn't her heart. Long story short, a number of things were missed, and while she is not a typical case, they shouldn't have been missed, as we now know. And had there been a team in place, rather than individuals, it would have been caught much earlier. We ended up in Toronto in a team-based environment that within 3.5 days got us a resolution, using all the clues that were in fact available within much of the work that had been done. And following open heart surgery, she is effectively, as far as her heart is concerned, perfect. So a team-based environment is really what we need in BC, and we don't have it. We have, in point of fact, lots of silos with excellent people who don't have the time of day to actually engage in broader thinking on any one patient, but to see that patient in the context of things that are expert to themselves, that they're excellent in. And if you fall within a certain category of patients that show up as having a thing that they can do something about, brilliant. If you don't, and you're missed because you're on certain margins and again, a lack of a team-based approach, you keep bouncing around the system. And in my wife's case, just to end it on a charming note, she looked down at herself that evening post-surgery, and she said, well, looking down at the mouth, she said, I always wanted cleavage. And that was end of a good story. But hence my remarks about the fact that we do need to get out of our geographic and health authority-based silos and move into something that makes a lot more common sense.
And I work for UBC Health, and for the last 10 years at least, I've been working to promote team-based models of care across the province. And it's really only been in the last year that the need for that and the importance of team-based care, particularly in our primary care context, has been highlighted for me. There was a young man who I knew, and he did not have a family doctor and was having some health problems. And he was trying to deal with these through walk-in clinics. And he finally got attached to a family practice and was diagnosed with cancer. And we talk a lot about attachment and the need for people to be attached to healthcare providers. And this young man, he was then connected with a team of amazing healthcare providers that he started to complain had no idea what they were doing and what they were talking about. And really, this really affected his trust in his team and the system as a whole. And he said, none of these people know what they're talking about. I'm going to stop treatment. And in talking to him and based on the lens that I come from and working around supporting primary care teams, I realized this was not an issue of healthcare providers that didn't know what they were talking about. They were all very competent healthcare providers in their own disciplines and their own professions. What it was is a situation of a team that wasn't actually practicing as a team. They weren't communicating, they weren't sharing information, they were giving him different messages, and that really impacted his care. Luckily, I was able to point that out to him, and he did continue on with treatment, and he's doing well today. But for me, that's the story that tells us that it's not enough that we attach people to healthcare teams, that they have access to healthcare providers, but that they have access to teams that are functioning as a team and working together truly collaboratively.
I'm a family physician in Nelson, BC, and I work in a collaborative maternity care clinic there. And I also work with the Rural Coordination Center as one of the leads with the Rural Obstetrics Network. And around the ideas of team-based care, where team-based care is really going to be influential in regards to providing care to a community, is when there's a collective sense of responsibility from everybody involved in the team to care appropriately and well and very with good intention for the entirety of the group of people that you're in service to. And that really is only going to happen when you're also reflective and honest with each other to take care of each other. We are all medicine for each other, and when we're able to break down those barriers and have flexibility and adaptability in how we approach care in a very family-based and family-centered way, that's when we're really going to be able to rise to provide integral care to everybody involved.
I like to talk about designing, planning, and implementing team-based care. And I wonder, in a system of care, how is it possible not to think about the role of the family caregiver in terms of who's on the team? So let's just take a look at a triad of care. You have the patient, the provider, and the caregiver. They provide 80% of the care. And yet, until very recently, they're typically not included in any conversations around who's on the team. So when we design this new future that we're excited to be considering, let's think about team-based care. Who's on the team? With family caregivers providing 80% of the care, they are on the team. Let's think about that.
I've been working in the area of healthcare education for over 10 years and really working to promote collaborative practice and team-based care models. And I've really never seen the type of momentum and commitment that we have today that's really been demonstrated at this meeting, and in terms of the number of partners that have come together and are actually talking about team-based care in a real way, in a way that's going to help improve the care that British Columbians receive.